this special broadcast and a very happy Independence Day to all the viewers of ET Now. I'm Tamanna Inamdar. Today on Independence Day, a slew of important measures and announcements have been made by the Prime Minister from the ramparts of the Red Fort, but one among them deserves greater scrutiny and a closer look and detail because it is one which could potentially change the way healthcare is dispensed to all Indians. We're talking about the National Digital Mission, the National Digital Health Mission, which was announced by the Prime Minister today. It envisages each Indian having a health ID card, and all of your medical data, your reports, your prescriptions, anything which you have experienced medically right from birth being available in one place digitally. Now, how will this work? How will it change the lives of Indians? Will it lead to more transparency? Importantly, how will it be implemented? We're going to talk about all of that in the next half hour. But first, let's take a look at what the Prime Minister said today.
हेल्थ सेक्टर में आज से एक बहुत बड़ा अभियान शुरू होने जा रहा है और उसमें टेक्नोलॉजी का भी बहुत बड़ा रोल रहेगा। आज से नेशनल डिजिटल हेल्थ मिशन उसका भी आरंभ किया जा रहा है। भारत के हेल्थ सेक्टर में ये एक नई क्रांति ले आएगा। इलाज में आने वाली परेशानियां कम करने के लिए टेक्नोलॉजी का बहुत सुविचारित रूप से उपयोग होगा। प्रत्येक भारतीय को हेल्थ आईडी दी जाएगी। ये हेल्थ आईडी प्रत्येक भारतीय के स्वास्थ्य खाते की तरह काम करेगी। आपके हर टेस्ट, हर बीमारी, आपको किस डॉक्टर के पास कौन सी दवा ली थी, उनका क्या डायग्नोसिस था, कब दी थी, आपकी रिपोर्ट क्या थी, ये सारी जानकारी इस एक हेल्थ आईडी में आपको समाहित की जाएगी।
All right, so how will this be rolled out and what kind of a change will be affected? Are there concerns about data privacy at all? Because this is about your own health privacy. Are there enough safeguards in place? And the most important question of all, will it actually lead to better treatment and more transparency for people from the medical system? Now, that question is going to be answered by K. Srinath Reddy, President of the Public Health Foundation of India, who's joining us on the show this afternoon. Dr. Sanjiv Badhwar, Head ENT at Kokilaben Dhirubhai Ambani Hospital, is also on the show. We're also speaking with Viren, Shetty, ED and Group COO of Narayana Health, and Anupama Joshi, partner at Deloitte India, also joins us today. Welcome to all of you and a very happy Independence Day. Mr. Reddy, let me begin with your opening comments on the scheme in itself. Can it be a game changer and a move towards universal health coverage in India?
Absolutely. I think it's a very important and somewhat delayed innovation. If you're really looking at care, particularly in the context of universal health coverage, but also in terms of appropriate and affordable care, there are certain elements that need to be looked at. First is continuity of care at any level of care, particularly at the primary care level. Then there is connectivity of care between the various levels of care. And third is the portability of care. That means if one person moves, let us say, from one city to another city or one state to another state, anywhere in India, there should be that portability element where the records are available so that everybody doesn't have to start investigating all over again. And these are going to be not only cost effective, but will also be helpful because it saves the patient from unnecessary investigations all over again. And this is going to be absolutely important, as I said, at the level of continuity of care, even at the primary care level. But if you're also looking at connectivity in terms of one specialist, for example, referring to another specialist, if the diabetes doctor wants to get a cardiologist to also have a look at the patient, then the records are immediately available and they're being carried by the patient. And these should become available without having to repeat many of the tests all over again. So I think having a composite data for each patient or each person is going to be very important from the point of view of optimizing care delivery for that person, but also in terms of providing universal health coverage with much greater competence and less cost.
Now, how will it work from a medical practitioner's point of view? Dr. Badhwar, I'd like you to come in here, but before you come in, I think it's important to also tell viewers what we know on how this would work. So this digital health ID will have all your data in one place, but it has been emphasized that this is voluntary. It's not mandatory to create this ID unless you are accessing government healthcare services. Any access to your data will again require your consent and will be for a short period of time. We will have to go ahead and see if all of these strictures are put in place. But from a practitioner's point of view, Dr. Badhwar, what is the challenge you see in implementability, and will it actually help you treat patients?
Thank you for the question. I'll answer it in two parts. Firstly, what are the challenges? And secondly, how is it going to help? So the challenges, what I see is basically technology access in remote areas. How do you monitor the efficiency of the system? Privacy issues, maintaining the data in the cloud, retrieving that. We are moving towards it, but there are huge challenges ahead. Secondly, initially to start with, this would mostly be in the government sector, but as you move forward, I'm sure the private players would also come in. And there, again, would be newer challenges. But I'm sure at the pace at which they've been working to get this platform ready, I'm sure all these are being taken into account. Regarding the medical fraternity, it would be of great help to us. You walk into the busy emergency of any busy hospital. Somebody comes in, accident victim, poisoning victim. When he comes in, sometimes he may have relatives or friends with him or not. If you have a health card with the biometrics, you can very easily access all the information you need to start treatment immediately. You get an idea about his medical comorbidities, his allergies, what medicines he's on, and this would mean instant access and would really ramp up the efficiency of our medical system. Such a system has worked extremely well in Asian countries too, like Malaysia, where they have a system called MyCAD, which is linked to their national identity card. And it's working pretty well there. And I don't see any reason why it should not work in our country.
Let me get a perspective from hospital administration. Viren, Shetty, at the end of the day, someone has to collate and upload all of that data in a central place. I'm not sure if it can be left to the patients at all. It will fall upon the doctors and the hospitals. Do you think that would be easy to do, considering the amount of data that hospitals generate right now?
Yeah, you brought a very valid point. There are definitely a lot of challenges with rolling out such a large-scale IT implementation such as this. It makes for great press, it makes a great announcement, and it gets someone like me on your show. But the fact is, for hospitals like ours, we've taken up a 3-year IT transformation process, and it is difficult. It is extraordinarily challenging. Our flagship hospital in Bangalore, a stone's throw from Electronic City, with the best IT connectivity and the best support available in the country, we still have challenges today from doctors not even being able to log on to their computers because they've forgotten the Wi-Fi password, right? It carries a host of challenges. Now, to answering your question on data being stored, no data is going to be stored on the person's card. The card is just a reference number. It need not have been announced as a separate health ID. You could have used Aadhaar, you could have used his name, you could have used his phone number. We run a health ID program for all our patients, and we use all of them. This isn't anything new. It's something hospitals have been doing for years. But honestly, this is not really in the top 10 challenges that hospitals face. Our biggest problem, if you want to do transformation, a lot more attention has to be given to what the government did last week, where they announced a series of 8 diploma courses in basic care for critical care, anesthesia, obstetrics, gynecology, radiology. Just producing more doctors is what's going to solve a lot more challenges in India. Digitization is more of a second or possibly third order problem that we face. But having said that, it is still a great program. It's something that will be of quite marginal benefit to hospitals that are already well run and well established. But this is really not going to make much of a difference in places where there's no computer, where there's no power, and where there are no doctors.
Yeah. No, point well taken. And Anupama Joshi, that's the real trick of implementing this. As Dr. Badhwar said, this will most likely be, used in government-run centers initially. Those that need to have all of their data together or quick access to the doctor will be people possibly also in remote parts of the country where these facilities will not be available. Let me add to that the fact that a lot of people in India, when they're sick, just go to their local chemist and figure out what medicine they want to take, or they self-medicate. People can order tests themselves as well. So how will you collate all of that data?
Right. So one thing that I would definitely like to say is, there has been a lot of resistance to moving towards digital models of care. And there have been a lot of resistance even within the medical fraternity to opt for these kind of models. The investments by hospitals in, interconnected or connected care have also not really felt very, very remunerative. So, there has been resistance to this. But I would like to say it's an idea whose time has come. It's well recognized. And the COVID pandemic has actually thrown in a lot of light on the way models have been adopted, whether it's government, whether it's private sector, whether it's, the doctors. A lot of resistance to using these digital models have really broken down. The consumers have demanded and the governments have obliged and the practitioners have obliged. So we have had, telemedicine guidelines coming out, consultation platforms coming up, home healthcare has seen and has been on the increase. A lot of different models which bring care closer to the home, have been rolled out during this pandemic. And a lot of the people that we speak to, whether they are healthcare providers, they are really looking at ways of, partnerships that can be built up so that they can provide a seamless, connected experience to the patients. Having said that, of course, the challenges in all the remote areas, they definitely continue. And but it's also a huge possibility. I mean, so far, people who could not get access to, specialists because they lived in remote areas, it's become much more possible. Telemedicine is again an idea that has been talked about over a decade, but it's only now that, it's actually coming to fruition. So like this, I think we will have to figure out ways. I mean, our broadband connectivity, our backbone, there are so many mobile telecom players. We have so much fiber optic network, all that is going to play a big role in bringing down.
I think you made an important point, Ms. Joshi. Yes. I think you made an important point, talking about this in the context of the current pandemic crisis that we are facing, and where we've had to leapfrog to digi-medicine, as it's being called. Mr. Reddy, I'd like your perspective on this, and how digitally being able to reach patients also increases the scope. Technically, a doctor anywhere can now consult with a patient anywhere, and if they have access to all of their latest reports and medical history, it will only increase the extent of patient care to that amount.
Most certainly. I fully recognize some of the difficulties that have been stated. If there are not enough doctors in primary care, if the primary healthcare facilities are poorly equipped, and the record keeping is not good, this will actually result in a very poor experiment in terms of data storage and data transfer. But nevertheless, we have to start breaking those barriers. We do need to strengthen our primary health care as well as other health services, but we need to move into better data collation and ability to access that. When I was an intern and a postgraduate student, we used to see patients actually having notebooks, students carry notebooks in which the doctors would write down, and then that would be the only record the patient would have. And God forbid, if there is a flood or a disaster, that notebook would get lost. Now you actually have an opportunity to have this kind of data available on call from any part of the country, and there can be consultations with other doctors as well, other hospitals as well. This doesn't mean that the weaknesses in our healthcare provision are going to be sorted out with this. No, but it certainly can make the actual evaluation of a patient much more efficient and economical, and this is definitely a step in the right direction.
Dr. Badhwar, does it also increase answerability for medical practitioners? Because everything you now prescribe, every test you order, every diagnosis is on record. So if there is any kind of, I'm not saying there is usually, but if there is any kind of malpractice of any kind of medical negligence, that also is on record.
Well, you see, Tamanna, times have changed, and most practitioners in large cities are ready for this. All well-run hospitals have electronic records. Your prescriptions are scrutinized. Your data is on record. The patient can ask for it. Every patient is entitled for a second opinion, and they're entitled for your prescription, your treatment guidelines. So most of us working in large cities, we are ready for this, and it also helps us because if you think you're practicing good medicine, you have to be open to scrutiny. You have to offer your patients the right of a second opinion, and that actually improves your practice. But the word has to spread. Every doctor practicing everywhere has to be ready for this. Times have changed. You have to be transparent. Your patients have to have access to his or her medical records. Your prescriptions would be scrutinized to see if they are on par with current guidelines. So yes, I mean, most medical practitioners are ready for this.
I think it's important to also raise the issue about data privacy. Ms. Joshi, do you have a take on this? So far in the theory of how this will work and how it will be rolled out, it has been mentioned and reiterated that this will be voluntary. You need not link to your Aadhaar unless you're taking up a government-funded service. The access to your medical records will be for a limited time only, and your consent will be required, etc. But do you think that there have to be stringent privacy, sort of systems put into place to protect patients from any kind of misuse?
Absolutely. This is definitely a requirement. I mean, the design, the way it has been indicated today, sounds very promising and gives the consumer a lot of control. But this has to be backed up by very strong data protection laws, which have to be rolled out in a way that there is wide understanding. I mean, awareness generation about the laws as well as what they entail, both on the part of the medical providers as well as on the consumers, will be very important. Because you may not be even aware of, what it means for you, and what kind of malpractice or rather, misuse of the data may happen because you have not taken the right precautions while giving your consent. So definitely, and the other thing is also that in terms of the data is going to be stored on cloud, so there also have to be enough provisions to ensure that that is cyber secure. So I'm sure a lot of debate has already happened on this and will continue to evolve as we move along this journey.
I think it's also important to talk about how this is the first round. Viren, you very rightly spoke about other sort of challenges we face medically, and I want you to elaborate on this in the context of what we've learned in the COVID pandemic. Now, for example, if we did have a system where medical histories were more easily accessible, by doctors everywhere, would it not have sped up the kind of treatment patients need during the pandemic?
Absolutely would have. So during the pandemic and the lockdown associated with that, not only did patients not be able to come to the hospital, 90% of the time our doctors could not even get to the hospital. And so being able to talk to patients online, and we created a portal that allowed patients to upload their records, it served a temporary and stopgap measure, which was quite useful. But if we were to extend the analogy and go forward, this is by no means a substitute for proper medicine. By no means that just because we create an online channel, will it take away the fact that someone needs to be on the ground in the clinic near the person's house who actually takes the history from him. Self-reporting of diagnosis is a phenomenally inefficient way of getting accurate data that's medically useful. And the other one is on the usefulness from the doctor perspective also. It's not true that more data always equals good. In that case, I have 100 emails a day. If I were to get 500 emails a day, I'll be a better manager. That's absolutely not true. Every doctor today has 50, sometimes 100 patients that he has to see, and he doesn't get to spend more than 5 to 15 minutes with every patient. On top of that, we add a layer of software that he needs to start inputting, and passwords and protections and all the things associated with that. And if you bring in a robust system of mechanical monitoring him, to ensure that he went through every piece of data, you can be sure it's going to take longer for every patient. And then you start to understand a lot more about why doctors are hesitant, because software has to enable. It can't just be this other thing that sits on top of the practice that's already there and overburdens the doctors. And as it is, we don't have that many of them. See, physician burnout in the United States, they identified among the top 3 reasons for physician burnout, number 2 was the medical record keeping, because they had to spend as much time filling out the forms as they had to do talking with the patient. Now, by no means should we ever get to that scenario. So whatever it is we do, we need to be cognizant that there are real-world challenges. We cannot roll this out in a hurry, and we can't digitize for digitization's sake. In the end, it has to all work towards the benefit of the entire medical community as well as for the patients.
So the first pilot projects begin from the end of this month in a few union territories, and then will be scaled up. It will possibly take some time for this to hit the ground. But Dr. Badhwar, I want your perspective on what Viren Shetty is saying. He's talking about potential burnout in doctors who have to now also do all of this record keeping. Is it really that cumbersome in your view?
Yes, he's absolutely right. You see, what happens is, in a busy practice, if you're seeing about 50 patients a day, the time to get to talk with them, meet with them, consult, gets compromised because you have to enter the data. Like ours is a paperless hospital. You have to fill up your data. You have to make sure that the orders are sent out, the prescription is filled out. This takes some time. So we move towards making this a little more faster, in the sense the initial entry is made by the associate so that most of the information is already filled in by the time the patient comes to you. But this does take a toll on practice. And like Mr. Shetty said, this was documented as one of the causes of physician burnout in the States. But like I said, this may be cumbersome. We have to work towards ways to making it more effective. But this is something which is the order of the day. And our community has not been really that, has not moved really that fast towards this aspect. And we need to get our act together.
Absolutely. That's actually a very brave admittance on your part, Dr. Badhwar, and how Viren Shetty was also describing doctors who are still struggling. Maybe this will lead to more employment opportunities, and medical practitioners will have to add on people to assist them in the record keeping, but no way out of it as of now. It is perhaps something that everyone will want to adopt sooner or later, provided the privacy guidelines are in place. That's a key, essential as well to correct implementation. I want to thank all of you for joining us on this special show. Wishing all of our viewers a very happy Independence once again.